Hi, this is Dr. Bhavna Kumari, a first year DNB Medicine resident at Government Institute of Medical Sciences, Greater Noida. I completed my internship in 2020 from RIMS Ranchi. NEET PG counseling is around the corner, and people with medicine as their first choice and ranks beyond 1500 or 2000 must have given some consideration to DNB medicine. They must also be skeptical regarding DNB and MD equivalence. So, first of all, let me give you a quick introduction about DNB. DNB for broad specialty. DNB, first of all, stands for Diplomate in National Board. It's a 3 years post graduation training awarded by the NBE after rigorous training and thesis submission. And regarding equivalence, quickly, I would say that DNB, if done from a government medical college or from a hospital with more than 500 beds, is in every length and breadth equivalent to MD or MS for that matter. And for the remaining, like if a hospital has less than 500 beds, or even lower, like 200 or 100 in some cases. For those cases, you need extra 1 or 2 years of senior residency, depending on the number of beds your hospital has. But mind you that these extra requirements are only for teaching posts in government medical colleges. For private and corporate setups, it's your skill and your knowledge which matter at the end. And for own setup, for your own private setup, you are your own boss. Let's quickly have a look on some of the points which I have curated, uh, which might help you in giving more consideration to DNB medicine, if at all medicine is your first branch of choice. Now let's come to the title of a video, that is why choose DNB medicine. My first reason is that we have NB conducted weekly classes. We have 2 to 3 classes per week with case discussions, journal clubs, OSCE discussions, and these are usually conducted by professors from reputed institutes. Mostly we have professors from AIMS Delhi, AFMC, and as soon you can have access to such classes as soon as you finish your thesis protocol. As soon as you submit your protocol to NB, you'll have access to these classes. My second reason is that we have centrally conducted exit exams. Now, why is this important? Because, of course, to pass both theory as well as practical exam, you need sound knowledge of Harrison's as well as other standard textbooks. And now that even NEET SS is a PG level exit exam, so you can side by side prepare for NEET SS as well. Maybe you don't even need a separate preparation for NEET SS. And even the MRCP paces, and you can say even to some extent even USMLE is based on DNB practical exam, is quite similar to DNB practical exam. And third reason is no bond in majority of the DNB institutes, except for ESI hospitals and few and a majority of the district hospitals as well. I think I don't need to emphasize on this, because this is a solid reason people with medicine as their branch of choice and want ranks within 1000 or 500, because of course you have to study even further, and we want institutes without bond. So this is a good solid reason you must take DNB. Fourth reason is that we have NB regulated fees and stipend. So unlike private colleges, which leaves holes in your pockets, you have to pay just a sum of 1,47,000 per year, including your hostel fees, if at all your institute provides you a hostel. And from this year, the government is even removing GST from your annual fees. You cannot be expected to pay a sum more than 1 lakh or something, and you cannot be paid a stipend less than that set up by the that state. Whatever stipend that state pays to its PG residents, you are going to be paid that. Fifth reason is that we have 6 monthly training assessment, meaning that as soon as you enter your program, you have a 1 month induction class. In class, actually these classes touch upon your basic medical sciences, as well as these classes give you an insight towards insight in towards your research methodology part. So that will of course help you in your thesis afterwards. And as soon as these classes get finished, we have an exam at the end of 3 months, and internal exams are conducted every 6 months. And before you appear for your final theory as well as practical exam, before that we have FAT, just like formative assessment exams, both theory as well as practical. So like you are under continuous scrutiny. It's not like that at the end of 3 years you'll be asked to appear in theory as well as practical with no preparation beforehand. So we are under continuous vigilance. Sixth is logbooks. Logbooks actually are literally are logbooks, because whatever you do during your residency in 3 years, whatever good things you do, you have to make a record, keep a record of these things, and these things have to be countersigned by your guide, and you actually are awarded marks. You actually are awarded marks based on what have you done throughout these 3 years. And the last is strict scrutiny of your thesis, which means that you cannot appear in your theory as well as in your practical exam, basically, unless your thesis is well accepted by the NBE. It's not like that you get your thesis done by somebody else, you manipulate your data or your calculations, and then your thesis will be accepted. It is under strict scrutiny. NBE strictly sees that thesis is done with proper methodology, and this of course enhances your research methodology skill, and later on you can use this skill to publish more papers and enhance your CV. So this was all about why one should choose DNB medicine without hesitation. Like if you haven't scored a very good rank, a rank within 1500, 1000 for that matter, and you are getting something which has suppose huge bond, like 3 or 4 years, or maybe even more than 2 years, then I think DNB is a very good option to consider. Thank you.